A week before Jonathan Chou began medical school at Keck, he showed up at my office, sent by Rita Sharon, after receiving a fellowship grant he'd received as a graduate of Columbia's Master of Science in Narrative Medicine program. The purpose of the grant was to promote narrative understanding in patient care, professional education and curriculum development, or to forge new pathways in research important to the growth of the field. And it required a mentor at the graduate's next institution who was willing to supervise the project. Jonathan had an elegant idea for a research study that paired medical students and patients in narrative medicine workshops in order to discern the effects of such an intervention. No spoilers, Jonathan's going to tell you about this in his talk. During his time at Keck, he also introduced narrative medicine to our colleagues at Special Services for Groups, or SSG. Shout out to Rebecca Gutierrez, who's here from SSG. And Jonathan conducted workshops for staff at SSG Alliance, thus laying the groundwork for the community health orientation of Keck's Master of Science in Narrative Medicine program. Jonathan is currently a clinical fellow in psychiatry at Harvard Medical School and a part-time lecturer in the MS in Narrative Medicine program at USC. He received his MS in Narrative Medicine from Columbia and his MD from Keck, where he served as principal investigator for 2 community-based participatory narrative medicine research studies. As a psychiatry resident at Massachusetts General Hospital and McLean Hospital, he was awarded a SAMHSA Minority Fellowship from the American Psychiatric Association to pursue a mental health advocacy project at the interface of narrative medicine and Asian American and Pacific Islander mental health. I am so proud to welcome Jonathan Chou, our former student, now our colleague, to share his vision of narrative medicine as a model for healthcare in the 21st century.
Hi, everyone. So thank you, Dr. Schaff, for that really nice introduction. And thank you, Dr. Wright, Dr. Rivera-Colon, and the rest of the workshop planning committee for inviting me to speak today. So again, I'm Jonathan Chou, and I'm a psychiatrist and one of the faculty members here at the Masters of Narrative Medicine program at Keck. And I graduated from the master's program at Columbia back in 2015, and I, as Dr. Schaff mentioned, live in Boston and work at Mass General and McLean Hospital. And I've been tasked today with sharing with you all some sort of introductory remarks about narrative medicine, what it is, what it can do, and why it matters. And I've titled my presentation, Narrative Medicine, a Model for Humanizing Healthcare in the 21st Century. So I thought what I might do today is start by sharing with you all how I think about narrative medicine and how it's shaped my work as a clinician, as an educator, and as a community advocate. And then I want to talk a little bit about what I see as the role of narrative medicine in helping us build stronger, more resilient, and more connected communities here in Los Angeles. My hope is that this can be a way for us to begin to think together, not only about how narrative medicine already appears in the work that we do and in the communities that we serve, and maybe even is what drives us, what makes us get up in the morning and go to work, but also how we might work together to build out our capacity to center the individuals and the communities that we serve through this vehicle of narrative. So some of the guiding questions that I'm going to be excited to sort of think about with you all over the course of today. How might we better attend to the richness of the narratives of the individuals and the communities that we serve? How might we honor the strength, the expertise, and the wisdom that's found at the intersection of narrative and community? And how might we harness the power of narrative to inspire each other and ourselves to action? So in this first part, the heart of healthcare, I want to talk a little bit about what narrative medicine means to me and how it might show up in your work, our work together. And I thought that one way to do that is I was thinking in preparing for this presentation that one of the questions that I get asked most often about narrative medicine is how it appears in my day-to-day work. And my sense is that this is really a question about the real world applicability of narrative medicine, its impact and its value. So something along the lines of how does reading and writing, which is, narrative medicine is more than that, but I think that's oftentimes how it gets translated is, how does reading and writing actually impact how you interact with patients? And I appreciate this question because it's kind of a hard one to answer, but it always ends up sort of opening up into a larger, more interesting conversation with the people that I'm talking to. And for me, this question is interesting for three reasons, which I think illustrate three key points about how we think about healthcare today and what narrative medicine attempts to accomplish in terms of deconstructing certain assumptions that we have about healthcare and also offering us a different way forward. And so this is where we're headed, is this definition that I want to offer to you all. Narrative medicine is a response to the contemporary healthcare system that revitalizes and builds out the human core of healthcare and recognizes healthcare as a fundamentally relational and collaborative human act. So let's return to this question: how does reading and writing actually impact how you interact with patients? The first thing that I want to say about this question is how it reveals something about how we think about value in healthcare, especially this bias that we have towards measurable, quantifiable definitions of value. It's reflected in our healthcare system today, where the patient themselves is sometimes actually secondary to the information that we have about them. The numbers, the quantifiable biological dimensions, the biomarkers, the levels, the lab values, the milligrams. And it makes sense in a way, because those are the things that we can optimize, that we can control and perfect. I'm going to represent that here with this square, which I thought emphasized in a way how healthcare sort of treats us as these sort of flat, generic units. We also see it in med ed, right? Medical education, where the knowledge of the sort of hard, quote unquote, hard sciences, which is what gets students good test scores, oftentimes gets contrasted against what ends up getting called, quote unquote, soft skills, like empathy, which of course, as we know, is not really a skill. But are there other ways that we can think about value in healthcare? How else might we evaluate whether something is meaningful? My sense is that these were questions that Rita Sharon was thinking about when she first founded the field of narrative medicine. The second thing that I think that we can say about this question, right, is the implication that narrative is an aspect of healthcare that we can bracket off, that we can separate out, that is just one part of what happens in healthcare. Like this, it's just one part of it. You can just kind of take it out and the whole thing kind of holds together almost. But does it, I guess? And to me, I think this says something about how we think about the place of narrative in our lives, how little we think about it. It's not that important. You can just sort of take it out. But, sort of again, in thinking about this presentation, I found myself wondering, on an average day, how many times do I actually think about my body as a sort of biological organism, as its anatomy, its biochemistry, its physiology. And I realized that it really is not that much. What it means to be me, or what it means to be you, really has more to do with what we do for work, what we do for fun, where we live, how we live, who's in our lives, how we spend our time, right? And so I think in some ways we've got it backward. Narrative is not a part of healthcare that can be separated or bracketed off. It's actually the core of it, the heart of it. You can't take it out without the whole thing falling apart. And I think, on a practical note, what happens when we think about narrative as something that can be separated out like this is that it actually limits our imagination of the impact of recentering, revitalizing, and building out narrative. If it's just this little blue circle here that stands for the place of narrative, of course it's going to feel unimportant. So I think this is, a central premise of narrative medicine, is that narrative is fundamental to health and it can't be separated out. Even we might even be able to say that health is fundamentally a narrative phenomenon or a narrative experience. And this gets to the last thing that I want to say about this question, is that this question is always about how narrative medicine, how does it benefit my patients? which it certainly does. But the truth is that it also benefits me. And I think this says something about how little we think about ourselves in healthcare, as involved and implicated in our patients' lives. And we have a long history in medicine of treating healthcare workers like they don't have lives. We've all heard the stories about how doctors and their grueling training, grueling training back in the day. But we also don't need to go that far back. Just in the last 3 years, we saw how healthcare workers were still being treated as if they didn't have bodies that also got sick or that also died. And this gets to the idea of burnout, right? Which really means work at the expense of our lives and the impoverishment of life to the point of a loss of meaning and purpose. So what happens when we begin to deconstruct some of our assumptions about value in healthcare, about the place of narrative in our lives, and about our involvement, our own humanity? This is what narrative medicine invites us to do. So to return to this definition, narrative medicine is a response to the contemporary healthcare system that revitalizes and builds out the human core of healthcare and recognizes healthcare as a fundamentally relational and collaborative human act. I should say that I've also come to appreciate this question, how does narrative medicine impact your practice, in another way, which is that the person that I'm talking to on some level wants to know in what way they also are doing narrative medicine. It's sort of like well, this sounds kind of interesting and I like what I do. Maybe I'm also doing narrative medicine. And when I sort of, get that feeling, I realize that I'm usually in good company. So, on that sort of along those lines, I've come to appreciate how narrative medicine, there's not one way that it looks like. And more than anything else, it's a model and an approach to healthcare that challenges us to rethink how healthcare is structured, how it's delivered, and how it's lived. So instead of this, this sort of emptied out and very much a kind of square, what if we thought about healthcare as a relational encounter, a narrative encounter, really? Or this as something that occurs in communities? Or even like this, as a sort of nested model of my narrative is contained within larger narratives, family narratives, community narratives, even planetary narratives. So when we think about narrative as a tool and a field of discourse, it allows us to have these conversations, to reimagine what healthcare looks like. And so just to answer the question about, how does this actually impact your work? For myself, I see all of my work, at least when I'm doing it well, as narrative medicine work. And I want to leave behind this idea of ownership and gatekeeping and move toward a vision of narrative medicine as a reorientation within existing structures and practices that I'm striving toward, along with many other people, many other communities, whether or not they call what they do narrative medicine. I also see narrative medicine as going beyond the realm of work. For me, narrative medicine is about seeing what I do within a larger context of humanity, of a shared existence on this planet, and of finding and creating meaning through my relationships with others in the past. If I can feel like I'm going out every day in search of the things that really nourish me and that make me grow, that's going to be the foundation upon which I can help others pursue the things that make them grow and make them feel nourished. So my sense is that narrative medicine has to be an important part of how we're going to solve some of the most complicated, tangled problems that we have today. Sometimes these are called wicked problems in the sort of design space. And in healthcare, the wicked problems are those problems that are not driven by biology or physiology, but that lie at the intersection of health, behavior, and society. These are the problems that have their roots in history and institutions and people, the way that we treat each other, the way that we've built these systems, structures, and institutions that reify differential relationships of precarity, vulnerability, and as Judith Butler writes, grievability. So whose lives matters? Whose lives do we grieve when they're lost? And these are problems that implicate all of us. I don't think any of us are unaware after the last 3 years of both how we're all vulnerable, but also how there are some of us who are more vulnerable than others, particularly some communities of color and poor communities. And I don't think that any of us are unaware that racism is alive and well and being lived out in us with lethal consequences. So what we need today is not another antidepressant, but new ways to approach this incredibly difficult task of community building, which is how we're going to be able to listen to those who have not been historically allowed to speak, how we're going to be able to build relationships with each other that are defined by truly mutual and deeply felt care. This is narrative medicine as a model and an approach to community building, to outreach, to advocacy, participation, empowerment. It's, for me, the real power of narrative medicine is its ability to span distances, to build bridges, to facilitate experiences of mutual recognition, solidarity, and action. And the truth is that we're all part of communities. So take a moment and think about one of the communities that you're a part of. I think we all have a sort of intuitive understanding of what that means, of what a community is. In psychiatry, we oftentimes talk about how no one becomes a subject, a self, without others. There's no self without the other. We owe ourselves to others. And we also know this to be true from the pandemic, right? And now, visualize that community. Think about the spaces, find their edges. Think about the structures that make up the material reality of that community. And think about the bodies that live and breathe that community. See their shades of color, their histories, their traditions. Think about who's a part of that community and also who isn't. And imagine that they too, like you, belong to a community like the one that you belong to. So what would it look like if at the places where we work, people across departments, across jobs, across salary levels felt heard by each other? That their life experiences, which we transmit to each other in the form of narratives, right? That's how we communicate, were valued. What would it look like if in the communities that we belong to, in the communities that we serve, and across communities, people felt that their lives were valued and that their voices actually mattered? This is something that I've been interested in for a long time. It's sort of what Dr. Schaff mentioned earlier. It's part of what inspired one of my very first narrative medicine research projects here at USC. So this is in 2016 in partnership with a clinic at LA County called the MCA, the Maternal, Child, and Adolescent Adult Center for Infectious Disease and Virology, which is a comprehensive care clinic that focuses on women, children, and families living with HIV, where we ran these sort of 5-week-long narrative medicine workshop series in which medical students participated actually alongside patients from this clinic. In basically narrative medicine workshops very similar to the ones that you're going to be experiencing today. And this was a really meaningful project for me because it showed me how even with the demographic data looking as different as it did, and here you don't need to be able to see the detail to sort of appreciate how, so on the left column is the medical students and the right column is the patients. You can see how the lines don't really match up. And I think that's really the point that I'm trying to make here, is that across sort of different demographic categories, there were quite a few differences, right? And what emerged from the study, what emerged from the qualitative data was really threefold. First, students and patients felt that the relationships that they developed with each other were characterized by mutual feelings of care. These were real relationships that they experienced. Second is that students and patients both felt that they helped and were helped by each other in reflecting on who they are and key formative life experiences. And third, students and patients in different ways felt that they were contributing to patient care and to medical education. I think especially, I think about the patients who oftentimes feel very disempowered in the healthcare system. They feel very stigmatized. They felt that they were really, really contributing to these students' education. One of them, ended up telling me that these students will never think about patients with HIV the same way after this workshop. And the medical students said the same. Yeah. And so this project is how we arrived at this idea of community-based participatory narrative medicine, CBPNM, which was inspired by this idea of CBPR, and hat off to Edgar for, really teaching me about this idea. So CBPR, community-based participatory research, is a way of doing research that involves community members at multiple levels of the research process and seeks to ensure that research actually benefits the communities where subjects are being recruited from. And so accordingly, this idea of community-based participatory narrative medicine, CBPNM, describes narrative medicine-based methods that involve two or more groups directly and at multiple levels of the design, intervention, and evaluation process, with the goal of articulating and strengthening the ties between those groups. I think we're only beginning to appreciate and sort of tap into the implications of the potential of narrative medicine vis-a-vis the CBPNM sort of model, which is above all, for me, I think a way to empower communities and the voices of marginalized and minoritized individuals, and to put them in dialogue with those who really need to hear their voices in an equalizing and equalized way, and starting from the ground up, so starting from our roots, our narratives. My sense is that CBPNM can serve as a platform for a wide range of efforts, from clinical care to research, to innovation, to quality improvement, to the arts, to organizing, whatever it is. I think being able to dialogue and listen to each other is going to be the foundation of that work. And so from my perspective, this is an important part, if not one of the most important parts of what we're doing here at USC, is using narrative medicine to partner with communities and other institutions to think creatively about how we might use the power of narrative and narrative medicine to work together, to work better together, to listen to the people that we're actually trying to serve, and to make sure that we're actually helping the people in the communities that need help. Those whose land we're standing on, those whose suffering and hard work we've benefited from. Just a few years ago, wanting to see what this idea of CBPNM would look like if we built it out, we reached out and did a project with the community-based mental health organization SSG Alliance, which is in the downtown LA area and serves individuals suffering with sort of dual diagnosis mental health and substance use disorders. And what came from that project is that SSG Alliance is now one of the main sites where our students in the master's program do their narrative medicine workshop practicum, where they learn how to facilitate narrative medicine workshops, just like the ones that you guys are gonna experience today. And so from the very beginning of their training in the master's program, our students are learning about narrative medicine in the context of community health and community mental health. And that's something that I'm really proud of. And I think something that really differentiates the USC approach to narrative medicine. And to me, this all feels very LA. What I love most about LA is not the beaches or the movies or even the weather, which are all things that I love, but it's the way that I feel like I sort of belong here in a way that I don't in other places in the US and honestly in the world. And I tie this to the way that medicine and healthcare are not easy places to feel a sense of belonging. I've certainly felt that as a clinician, and I'm sure my patients feel the same way. Healthcare is full of alienation, of dehumanization, of being seen only as a body or only as a patient, and this general sense of powerlessness. And at the same time, I know, and I know that you know, that health is tied to our sense of who we are, our relationships, and our communities. So narrative medicine as an approach to strengthening, investing in, empowering, and building bridges across communities needs to be a part of how we tackle our really wicked problems. So in closing, I want to thank you all for the work that you do and for being here. And I hope that I've done a good enough job, as we say in psychiatry, of demystifying narrative medicine and making the point that for all of us, there's a part of what we do that is driven by narrative, and that's a very fundamental part, if not the heart of what we do, even if it's not something that we all talk about or necessarily invest in. And secondly, I hope that I've gotten us sort of thinking, ruminating a little bit about what purpose narrative medicine might serve for each of us and for all of us together. whether it's at the individual client level, the team level, the organizational level, or the community level, especially in terms of how it can facilitate dialogue between communities. Finally, just as we begin to move into the post-COVID era, I want to urge everyone to think about how we may be leaving the pandemic behind, but in what ways we and the communities that we serve, excuse me, are still haunted by what we went through, what we're still going through. It's going to take time for us to recover, to mend these fractures in our communities and honestly ourselves, and especially for young people and people of color. And I feel this acutely with the rise of anti-Asian hate and violence. We're at a juncture where what we do now is going to have an effect for decades to come. So with that, I can't emphasize how excited I am to be here with you all today and to meet so many new people and to talk with you all. So please, please come up and introduce yourself to each other. And, it's really about you all and sort of making these connections. And I guess with that, I'll say thank you. Thank you very much.